Hello friends, let's see Inguinal Canal. In our previous video lectures, we have already completed the anterior abdominal wall layers. Out of them, the three flat abdominal wall muscles along with the fascia transversalis, they are concerned with this inguinal canal. And this inguinal canal, it is nothing but it is a canal situated between the deep inguinal ring, which is present within the fascia transversalis, and it extends up to the superficial inguinal ring, which is actually present within the aponeurosis of external oblique muscle. And this inguinal canal, it is made up of muscles as well as the aponeurosis. So we can say this inguinal canal, it is musculo-aponeurotic tunnel, and it is around 4 centimeter in length. So for the better understanding and the orientation of this inguinal canal, let's see one schematic figure. Here, this is the figure number A, where we are going to draw the external oblique muscle, and for that, here this is the anterior superior iliac spine, and this one is the pubic tubercle along with the pubic crest and pubic symphysis, and this one is the part of the obturator foramen. And between these two structures, anterior superior iliac spine and the pubic tubercle, inguinal ligament lies. And this inguinal ligament, it is the lower free margin of the external oblique muscle. So this is the external oblique muscle, what we are able to see here. At the medial end of this inguinal ligament, one defect in the aponeurosis of the external oblique muscle is there, and that defect, it is called as the superficial inguinal ring. And the superficial inguinal ring having one inferior crus which is laterally situated and one superior crus which is medially situated, and having one apex and one base. Near the apex, both the crura of this superficial inguinal ring, they are strengthened by the one aponeurotic fibers, and these aponeurotic fibers, they are the intercrural fibers. The base of the superficial inguinal ring, it is formed by this pubic crest, and the apex, it is situated at the meeting point of the superior and the inferior crust of the ring. Some fibers from the inferior crust, they passes upward and they are going to meet with the same fibers of the opposite side after crossing the linea alba, and these fibers, they are called as the reflected part of the inguinal ligament. And this reflected part of the inguinal ligament, it passes in front of the conjoint tendon, which is going to be formed by internal oblique and the transversus abdominis muscle. Now when we see the medial end of the inguinal ligament, one more ligament is going to be formed, and this triangular ligament, it passes towards the pecten pubis, and this ligament, it is called as the lacunar ligament, which also we have discussed already in our previous lecture. And the continuation of this lacunar ligament on the pecten pubis, and that ligament, it is called as the pectinate ligament of Cooper. So this image, it is of the external oblique muscle. Now let's see the second figure, that is the figure number B, and in this figure we are going to see the fascia transversalis. So here, this is the anterior superior iliac spine, and this one is the same pubic tubercle, pubic crest, and the pubic symphysis along with the part of the obturator foramen. And for the reference, we are drawing here the inguinal ligament. And this figure, it is of the fascia transversalis. So this figure, it is situated on the deepest part of the anterior abdominal wall. So here, this fascia, it is the fascia transversalis, and within this fascia transversalis, we find one gap, and this oval gap 1.25 centimeter above the midpoint of the inguinal region, and this mid-inguinal point, it is situated between the anterior superior iliac spine and the pubic symphysis, and this gap, which is present 1.25 centimeter above the mid-inguinal point, and that opening, it is called as the deep inguinal ring. And this one is the lateral end of the inguinal canal, and this is deeply situated within the fascia transversalis. That's why it is called as the deep inguinal ring. And for the reference purpose, let's draw the superficial inguinal ring here. And the tunnel between this deep inguinal ring to the superficial inguinal ring, it is called as the inguinal canal. And this inguinal canal, it is the 4 centimeter in length, and it is directed downward, forward and medially, because it is passes from the deep inguinal ring to the superficial inguinal ring. The deep inguinal ring, it is situated laterally, and the superficial inguinal ring, it is situated medially, while the deep inguinal ring, it is deeply situated within the fascia transversalis, and the superficial inguinal ring, which is present within the aponeurosis of the external oblique, which is little bit more superficial. And the direction of this inguinal canal, it is also from the deep inguinal ring to the superficial inguinal ring. That's why it is downward direction. So the direction of this inguinal canal, it is the downward, forward and medially. And this inguinal canal, it is made up of the muscles as well as the aponeurotic fibers. That's why it is the musculo-aponeurotic in nature. Now let's see the figure number C, and in this figure we are going to see the internal oblique muscle. So here this is the anterior superior iliac spine, and this one is the same structures of the pubis bone. And for the reference, we are drawing here the inguinal ligament. As we have already discussed in our previous lectures, this internal oblique muscle, it is going to arise from the lateral 2/3 of the inguinal ligament, and this deep inguinal ring, which is situated within the fascia transversalis, it is somewhere present here at the mid-inguinal point. So the internal oblique muscle, it is going to arise beyond the deep inguinal ring, and the muscle fibers of this internal oblique muscle, it is going to arise somewhere like this, and the lower fibers, they are going to curve and going to form the aponeurotic fibers, which are going to insert over the pubic crest as well as the medial part of the pecten pubis. And this tendon, along with the aponeurotic fibers of the transversus abdominis muscle, it is called as the conjoint tendon. Now let's draw the figure number D, which is concerned with the transversus abdominis muscle. As we already know, this transversus abdominis muscle, it is going to arise from the lateral 1/3 of the inguinal ligament, and the deep inguinal ring, which is present within the fascia transversalis, it is just above the mid-inguinal point. So this transversus abdominis muscle do not cover this deep inguinal ring. And the fibers of this transversus abdominis muscle, they form the conjoint tendon along with the aponeurotic fibers of the internal oblique, which are going to curve on the medial side of the deep inguinal ring and going to insert over the pubic crest and the medial part of this pecten pubis. And this conjoint tendon, it is formed by the aponeurotic fibers of the internal oblique as well as the transversus abdominis muscle. Some medial fibers of this conjoint tendon, which are going to curve around the medial wall of the deep inguinal ring, and these fibers, they are called as the Inter-Fabular Fibers, which are going to insert over the pecten pubis. So these Inter-Fabular fibers, they are going to form the medial relation of the deep inguinal ring. So after completion of this all 4 figures, we can see that the figure number A, it is the external oblique muscle, which is the most superficial figure. Then the figure number C, that is the internal oblique muscle, which is just deep to it, and just deep to it we find the transversus abdominis muscle, and more deeper to it we find the fascia transversalis. So this inguinal canal, it is made up of these 4 areas, and this inguinal canal has to pass from fascia transversalis starting from the deep inguinal ring and has to reach up to the superficial inguinal ring. So after having this much information, let's see the boundaries of the inguinal canal. We will see the anterior boundary of the inguinal canal first. So here we are going to trace the anterior boundary within this all four figures. So when we see the anterior boundary of the inguinal canal, we can say that the anteriorly there are skin, superficial fascia, as well as the external oblique aponeurosis muscle. And in this figure number C, we can see that this internal oblique muscle, it is also going to cover the deep inguinal ring, and that's why this internal oblique muscle, it is also going to form the anterior wall of the inguinal canal. When we see the transversus abdominis muscle, this transversus abdominis muscle, as it is going to arise from the lateral one-third of the inguinal ligament, and that's why it is not going to cover the deep inguinal ring from the anterior side, and that's why transversus abdominis muscle, it is not going to be formed the anterior wall of the inguinal canal. And the fascia transversalis, here we can see the deep inguinal ring itself is the opening within this fascia transversalis. So this fascia transversalis, it is situated posterior to the inguinal canal, and that's why this fascia transversalis, it is also not going to form the anterior wall of the inguinal canal. So anterior wall of the inguinal canal, it is going to be formed by skin, superficial fascia, external oblique aponeurosis, and the internal oblique muscle in its lateral half of the inguinal canal only. When we see the posterior wall of the inguinal canal, the posterior wall of the inguinal canal, it is going to be formed by conjoint tendon, which is going to be formed by the internal oblique aponeurosis and transversus abdominis aponeurosis. This conjoint tendon, it is situated posterior to the inguinal canal. That's why this conjoint tendon, it is going to form the posterior wall of the inguinal canal. Along with the conjoint tendon, the reflected part of the inguinal ligament, which is going to be formed by the inferior crush of the superficial inguinal ring, and it passes in front of the conjoint tendon to meet the opposite sided reflected part of the inguinal ligament across the linea alba, and that's why this reflected part of the inguinal ligament, it is also going to form the posterior wall of the inguinal canal. But both these structures, conjoint tendon as well as the reflected part of the inguinal ligament, they are going to form the posterior wall only in the medial part of the inguinal canal, while the posterior boundary of the whole length of the inguinal canal, it is going to be formed by this fascia transversalis, because it is present just posterior to the inguinal canal. When we see the floor of the inguinal canal, the floor of the inguinal canal, it is going to be formed by the upper curved surface of the medial half of the inguinal ligament, and along with that, towards the medial aspect, it is also going to be formed by the lacunar ligament. When we see the roof of the inguinal canal, the roof of the inguinal canal, it is going to be formed by arched fibers of the internal oblique as well as the transversus abdominis muscle, because both these muscles, they are going to curve over the inguinal canal to form the conjoint tendon, and that's why the roof is going to be formed by internal oblique as well as the transversus abdominis muscle. So we can say that the internal oblique muscle, it is going to form the anterior wall, roof, as well as the posterior wall of the inguinal canal. Anterior wall by its fleshy fibers, roof by its arched fibers, and the posterior wall by its conjoint tendon. So for that, let's see this figure for the more orientation.